equine veterinarian. For those of you who, like me, had dreams of being a large animal veterinarian when you were younger, you're probably going to be in for a real treat. For those of you who aren't, you're going to learn a great deal. Following those 100 hours, Alyssa spent 40-plus hours engaged in really focused research into the topics she observed and has subsequently written 3 research papers associated with that research. She's prepared for you all today, and I know that you'll give her the attention that that kind of effort would require. Thank you.
Good morning. My name is Alyssa Dodd, and I titled my presentation, Healthy as a Horse. This summer, I spent my mentorship with Coastal Equine Veterinary Service, observing the calls of Doctors Spanigal, Burgess, and Sweeney. These vets obtained their majors in a variety of fields, including biology and chemistry, and 2 of them went on to obtain their graduate degrees from Virginia Tech, and 1 obtained their degree from Ohio State. Coastal Equine is a large animal veterinary practice that specializes in performance and companion horses and services farms within a 2-hour radius of their location in Chesapeake. They are also an ambulatory practice, which means that they travel to their clients. My first case study was on a disease called equine odontoclastic tooth resorption and hypersematosis, or EOTRH. This disease is characterized by resorptive lesions that form in the tooth root, and these lesions are idiopathic, which means that their cause is unknown. As the body's response to this resorption, hypersematosis occurs, which is a buildup of excess cementum. Cementum is a calcified substance that typically anchors the tooth in place. This disease affects incisors and canines and is typically seen in horses that are over 15 years old. This is a very recently discovered disease, mostly because veterinary advances have allowed more horses to live to the older ages when this disease becomes prevalent. So this is an x-ray of a horse with EOTRH, and these opaque areas here and here are low bone density areas, and this is where the resorptive lesions occur. And these white bulbous areas in the tooth root are the hypersematosis. And you would think that this hypersematosis would be a great thing because you want the tooth to stay in place, but actually this starts to cause more complications. One of these complications is severe gum inflammation. This disease is also associated with large amounts of pain, which cause symptoms like head shaking and loss of appetite. During my mentorship, I saw 1 horse who had EOTRH, and upon arrival, the veterinarian examined the horse's teeth, which were physically disfigured, similar to this photo here, where you can see the extreme gum inflammation, and the incisors are actually angled slightly more than normal. So radiographs were then taken to confirm this diagnosis and map out a treatment plan. And after analyzing the radiographs, the veterinarian decided to have all of the incisors removed. And this is a very common treatment because there's not a lot that's known about this disease, so there's not a lot of treatment options available. Luckily, this treatment has few to no long-term effects, and the horse very quickly learns to adjust to not having incisors. This is a picture of a horse that I saw during my mentorship who actually had a molar extraction, but the process for a molar and incisor extraction are very similar. The horse is under standing sedation, and a fulcrum is used for leverage, while an extraction tool pulls out the tooth, similar to the way you would pull out a child's loose tooth. My second case study was on the lower hind limb anatomy, and I focused on the pastern and coffin joints and compared them to the human interphalangeal joints. So this right here is the pastern joint, and this is the coffin joint, which are located in and directly above the hoof. And the human interphalangeal joints are here and are found in the toe tips and fingertips. From this comparison, you can see that horses stand on the equivalent of their fingertip or toe tip, specifically their middle fingertip. And if your average horse weighs about 1,200 pounds, this means that 300 pounds of pressure are put on their fingertips and toe tips. So if you could imagine putting 300 pounds of pressure on your finger, it would probably snap. But horses have developed this anatomy as a cursoral adaptation, which means it's designed to run from predators. This excess pressure, either developed over a lifetime or from a lot of work, can cause joint damage. And owners typically notice this joint damage as lameness, which is a gait irregularity, and this prompts them to call their vets. And a common treatment for this lameness is joint injections. For my case study, I focused on hock injections because those are the ones that I most commonly saw during my mentorship. So this is another comparison x-ray of the horse's hock, which is located about midway up the hind leg, and the human ankle. And both of these are similar joints as they both contain tarsal bones. So hock injections are more popularly used because they are low motion joints, and that means that they're more susceptible to rotational and shear forces, which increase the likelihood of lameness. Each practice uses their own concoction of medications to go into the joints, but these medications typically fall under 3 categories. The first is hyaluronic acids, or HAs, which are natural joint lubricators found in synovial fluid. The second is corticosteroids, which are potent anti-inflammatories. And the third is polysulfated glycosaminoglycans, or PSGAGs, which inhibit destructive enzymes that are found in the joints. These injections can be re-administered every 6 months to a year typically, just depending on how the horse responds and how long the effects will last. So I saw multiple hock injections during my mentorship, but I focused on one that I saw that had hock injections for the first time. So the owner had noticed some lameness in her horse and had the veterinarian come out to do an exam. So after watching the horse's gait, the veterinarian did a flexion test. And a flexion test is used to determine the origin of the lameness. And during these tests, suspected joints are flexed to their range of motion limits and held there for approximately 30 seconds. And then the horse trots off from this position to see if a significant increase in the lameness is elicited. So this is a horse who's having the hock flexion test done. So during my observation, the hock did have a significant response. So it was determined that that was the origin of the lameness. So radiographs were taken to assess the severity. And after analyzing the radiographs, the vet and the owner decided to have the hocks injected. My final case study was on wound healing, and I focused on a horse that I saw during an emergency call who lacerated his right hind cannon after being caught in some fencing. The cannon is located directly below the hock, and this is a picture of the injury in the inflammatory phase, which occurs 6 to 8 hours after initial injury. This phase is marked by pain, inflammation, and swelling. The veterinarian elected for primary closure, which just means that sutures are administered immediately. And the far, near, near, far suture pattern was used, which is a tension-relieving suture. After the sutures were in place, the wound was then bandaged to prevent infection. So this is a diagram of the far, near, near, far pattern. For this pattern, the first bite or incision is inserted far from the skin edge. The wound is then crossed. The second bite erupts near the skin edge. The third bite is also near the skin edge. And finally, the last bite erupts far from the skin edge. And then a surgeon's knot is employed to keep the suture in place. There are a variety of different suture patterns, and it's just the vet's decision on which they think will be most effective in healing the wound. The second phase of wound healing is the debridement phase. This occurs 6 hours to 5 days after initial injury and is characterized by pus exiting the wound. Pus is actually a natural wound cleanser that aims to flush debris and dead cells from the wound. The third phase is the repair phase, which occurs 3 to 11 days after initial injury and is marked by the formation of granulation tissue. And this right here is the granulation tissue formed on the wound. Granulation tissue is a major healing tissue that actually uses blood to heal, so it bleeds very easily. And this is why vascularity is so important in wound healing. And areas with poor vascularity or blood flow, such as tendons, take much longer to heal. A problem that can occur during the repair phase is the presence of proud flesh, where granulation tissue actually forms up over the healthy skin and prevents the wound from closing. When this happens, typically the veterinarian will just take a scalpel and debride the granulation tissue from the skin edge, and the wound can continue to heal. The final phase of wound healing is the maturation phase, which occurs 17 days to 2 years after initial injury. During this phase, the body essentially returns to normal. This means that capillaries will dilate and scars will form and fade. So in order to become a veterinarian, as I mentioned before, you must obtain your major in a variety of different applicable fields, and then you have to have a graduate degree as a doctor of veterinary medicine. And then a state license must be obtained for the state that you wish to practice in. And each state has slightly different licensing requirements. The median salary for a vet in 2012 was $84,460 a year, and this field is expected to have a 12% growth from 2012 to 2022, which is about as fast as average. So overall, my mentorship was extremely positive. I absolutely loved it. The clients were great. They were really interested in my project and always willing to let me observe their horses and take pictures when I needed to. One client even let me feed her baby calf that she had just bought. And it was very involved, especially for a medical mentorship. I was always able to directly observe the horses and ask questions and talk to clients. And if there was an x-ray that I could see or something that I could hear through the stethoscope, I was always allowed to experience that. It was very fun and interesting work. It was something I was really genuinely passionate about. And the calls were usually, I was trying to schedule on days when the calls would be more fun and something that I maybe hadn't seen before. The staff was really friendly as well. They were also very interested in my project and always willing to answer any questions and concerns I had. A couple of drawbacks were that our schedules were a little unpredictable. We had some very, very long days and we could always be called out on an emergency. And there was lots and lots of driving. As I mentioned, it's an ambulatory practice. So in one day we could start from our location in Chesapeake and go to the Eastern Shore and then go back down to North Carolina and then go all the way out to Portsmouth. So some days we spent more time driving than actually attending calls. Sometimes the calls got a little bit repetitive. There was lots of vaccinations and sometimes the calls in the same day were very similar. So in conclusion, I'd like to say thank you to all of my mentors for being so fundamental in this project, the Coastal Equine staff for corresponding with me and always making sure I knew what time to be there in the morning, Ms. Graves for helping me throughout my project from the proposal to this presentation, my family for supporting me and taking me to my mentorship site when I needed them to, and to you for being an amazing audience. Are there any questions? Yes, Ms. Graves?
What kind of preparation did you need to do before beginning this mentorship experience?
Well, my mentor didn't require me to have any preparation, but I did a little bit of background on the anatomy and nerve structure and tendons, which definitely helped me to write these case studies. Yes?
When a horse is diagnosed with lameness,
Yes.
what is the difference in the way it trots when it does have lameness compared to when it doesn't?
That's a great question. He asked what visible differences are seen in the trot when a horse has lameness. Typically, vets will look for, if the horse is trotting in a straight line, their hindquarters are supposed to be equal, like rise equally with each beat of the trot. And if lameness occurs, typically one side will rise higher than the other, and that's a good indicator of lameness. Also, if your horse is trotting in a circle, then a short step to the inside also indicates lameness on that leg. Yes, Ms. Kat?
You showed the x-rays of the hock and the ankle and all of that. Basically what that, anatomy is not my thing, but basically what that means is that all that space between what feels like an elbow on that hind leg is really foot?
Yeah,
on us?
that's their entire foot, is
Okay.
from their knee to their hoof or from their hock to their hoof. Yeah, so it's definitely very drawn out. Yes.
When you mentioned they had the insiders removed, and then you said it really doesn't affect quality of life, how are they able to eat the grass?
Well, typically they'll learn to grasp it with their lips and pull it up, and there's a lot of other different like forage that owners can get to help them adjust a little bit better. Yes.
You said that states have different things for the license. Do you by any chance know what Virginia has?
He asked what Virginia has for their state licensure requirements. I don't know the exact every specification, but I know that all licensing has to pass the same exam. And I think Virginia's has also their own separate exam that they have to pass as well. Yes?
How does this influence like your future plans?
That's a great question. She asked how this influences my future plans. I definitely want to pursue this career. These mentorship opportunities are great because they allow you to kind of look into this career for a small period of time. There are so many people who get their degrees and then realize that that job's not for them. So this is a great opportunity for me, and it definitely solidified that this is something I want to study further and potentially investigate as a career. And I also maybe was thinking about going into veterinary surgery after doing this mentorship because that was something that really interested me. All right, well, thank you.